What's up, family? So, if you have prostate cancer, or you know someone who has been diagnosed with prostate cancer, at some point in time, they have to make a decision. Well, that decision is to not do anything, not have any treatment, be on active surveillance where they monitor their cancer, or actually having some type of advanced surgery. At some point in time, a decision has to be made. So today I want to talk about the decision that I made regarding my treatment going forward. But before I talk about my decision, I'd like to share a quote that I read and my thoughts about it and how it may affect just me in general and others going forward. So today's thought is that all events or challenges that we are experiencing have a reason and a purpose, and ultimately they help us evolve into the best version of ourselves. I hear people ask the question, why does bad things happen to good people? Well, I used to ask that similar question, but now that I'm older, I've come to realize that it's the people who have gone through challenges and who have overcome those challenges are the ones that we tend to admire the most. It's through those challenges that they have won, make this world a better place, but they become a better person in the process. So with this diagnosis or challenge that I'm facing, I see it as an opportunity to help others, but also to help me evolve into a better version of myself. So ultimately, life is happening for us, not against us. So, a little bit about myself for those who maybe just started watching the channel and haven't seen some of my earlier videos. I'm a 54-year-old male who was recently diagnosed with prostate cancer. Fortunately for me, I was diagnosed early, so I was Gleason or grade 1 prostate cancer was my initial diagnosis. Those who have been watching the channel, my decision initially and currently I'm on active surveillance. So after talking with my doctor and the stage I was in, the decision was I had time to continue to watch it, and active surveillance was the direction that I initially chose. And the reason why was, the other options are more invasive, and I really didn't want to head that route. Secondly, if you've seen from my earlier videos that, my understanding of prostate cancer is that for the most part it's slow moving, so it doesn't require you to have to make a rash or quick decision, unless I'm assuming if you probably further down the road. But where I was at, that was not the case. So being on active surveillance not only allowed me now to quickly get any treatment, but also give me time to learn and basically know more about prostate cancer and the additional options for treatment. The other thing was that, my understanding of the cancer was that once you're diagnosed, it doesn't change. What could happen that more advanced cancer could grow, which would make you, for instance, go from a grade 1 to a grade 2 or be accelerated based off of additional cancer growing. And so my thought was that, okay, being on active surveillance, I could learn about different treatment options during this time frame, but also I could start changing my lifestyle. Hopefully, with more exercise, eating different, that my PSA scores could potentially stop, or hopefully even get reduced, such that active surveillance is not something that I'm temporarily doing, but it be something that would be a way of life that I can do forever, with the thought of never having to have treatment. So that's what my original thoughts on why I chose active surveillance initially, then immediately go into any kind of advanced treatment. So now where I'm at now is that over the last several months, I've been going in and getting my PSA testing done, and I guess unfortunately, I have to report that they haven't stayed stable or went down, but they've actually over the last several tests increased, continue to elevate as I continue to take my tests. And the most, I guess, concerning one that I have is more around the PSA density part of it. And so there's a level based off your prostate cancer, your prostate size, and your PSA test is basically if when you get above these ranges, it's more of a concern that there's more advanced growth, and it's not just because of the size of your prostate that's driving those numbers, but other elements related to the cancer cells. So as that starts to increase, that led me to now to really think about other options and actually doing something. I still, again, even if as I'm thinking about the other options, still an opponent of active surveillance. I believe that no one should rush into doing anything. But as I'm, I don't want to be where I'm just delaying the inevitable. If my thoughts of being on active surveillance is that over time I would never have to get surgery or any type of advanced treatment. And so, as my tests starting to continue to get elevated, that's seeming less likely for me. Is my thought. And so, a lot of folks ask, why folks don't stay on active surveillance forever. For me, my concern is that even though there's a benefit of waiting, most folks say, well, if you end up having to get advanced treatment 4 or 5 years down the road, then there's a benefit because the treatment could have got more advanced. So as doctors learn more, then the side effects or the negative portion of this could be reduced. My concern is that, or my thought is that I don't want to wait, to be in my 60s to have any type of major surgery. I feel like I'm healthier now and my body can sustain anything that I have to do now than later. So that's my primary reason of saying, even though I think I could continue to wait, and it's just the fact that these things are happening and the risk of don't want to do anything, having a wife and a daughter that could cause something to happen to me that would cause me to lose my life, even though, it's being monitored, but it get worse. And just that versus the fact that, do I want to be doing something later in life where even when I'm thinking right now, I'm healthy, I believe that I can go through the surgery or go through the treatment, advanced treatment, and still come out of it, well, or point where I'm still able to live my life. Is the reason why, for me, I'm chosen to do something now. So what am I thinking about? So, as we know, the two options is radiation therapy or actually surgery, prostate removal surgery. If you saw my earlier videos, and I'm gonna post one to two options down in my in the bottom of my chat is two options I kind of went through. I made videos about it, but my initial thought was, I want to do radiation. I'll do radiation therapy over this surgery. I can, going in, getting the treatments, even though it was mentioned 8 weeks and everyday type of treatment, I feel like that was less invasive than actually having to go into surgery and what would it take to do that and recover from. Well, my thought has changed. At this point, I am chosen to do surgery, and the primary reason why for me, and I think this is a personal choice for my I think unique circumstances, is that not only have I been diagnosed with prostate cancer, I also have an enlarged prostate, and what that means is that if the treatment for that, if it continued to get worsened, would mean having my prostate removed. So if at the end of the day I'm battling with this and it may cause me to have to get my prostate removed, my thought is that why not? Then it only makes sense to me is to go ahead and get that done, that basically address both of them with the same surgery versus going through radiation treatment, which doesn't cure your enlarged prostate, and then later down the road having to deal with that, which means having my prostate removed. So I've made a decision, and that decision is to get having the robotic radical prostatectomy surgery. I'm looking to do that sooner than later, and primarily because the time of the year, I'm able to actually take the time to do it and actually have the time to recover without having anything major going on in my life that would be stressful or would cause me to have to feel like I can't properly rest and heal. So this is for me like the time that allowed me to do that and really work on myself, and also give me, I've since being diagnosed, I've done a lot with changing my eating habits, working out a lot. So I feel really good health-wise to be able to go through this type of surgery. So for me and those listening, those are my thoughts. Every man has to have their own guiding principles, but I at least want to share what I'm thinking. And as I mentioned earlier, that has been my goal in this, is to give other folks someone else's thoughts. And so as they're bouncing around what they're thinking about, they have some other person that they listen to that's not a doctor sharing and informing their decision making. So that's why I'm making a decision to, one, go ahead and have surgery, even though I believe active surveillance is definitely the right choice that I made initially. And if I were to stay on it, it wouldn't be a concern. It's more from a personal standpoint of just not wanting to wait if I feel like directionally it's going to come to that eventually. And so I'd rather be where I'm mentally prepared to do so. Go ahead and tackle this now than later. So as always, family, I'm going to keep everyone up to date. My next course of action is prepping for when the surgery occurs. So I'm continually, like I say, eat right, work out, getting things prepared at the house and for my family, so that while I'm going through the recovery part, I can do that well. I will keep, as always, I'm gonna keep everyone on the channel informed. And again, I'm gonna post some of my earlier videos down below so that you have those as reference points for those who are just now starting to watch my videos. Again, thanks everyone, and leave comments in the chat for others who's coming down the road that this may be beneficial. As it was beneficial to me to read, to go in and watch other videos for other men, that this will be beneficial to others who will be coming after me. So again, be blessed, family. The goal of this channel is to bring awareness to prostate cancer and prostate cancer treatment. My desire is to inspire, educate, and serve others by sharing my personal experience with prostate cancer and the knowledge I've gained along the way. Prostate cancer affects about 1 in 8 men in their lifetime. The challenge is that there aren't many symptoms, but a simple blood test can catch it early. Early detection can be life-saving. So talk with your family, friends, and loved ones about getting screened today. And if you are a man, talk to your doctor.